Melanoma is one of the tumors in humans in which genetic susceptibility is more important. More than 50% of the risk to develop melanoma depends on the genetic susceptibility. Then this genetic susceptibility is important not only for the risk to develop, but also is associated to some clinical and phenotypic characteristics of the patients and the tumors. And I review some of them. Interestingly, MC1R, melanocortin-1 receptor gene, polymorphisms, can also determine clinical characteristics and dermoscopic characteristics of the nevus and the tumors, melanomas. What I presented is that red hair polymorphisms are associated to an increased probability to have blue nevi. And on the dermoscopy of the nevi, these nevi in patients with red hair polymorphisms are larger, with a hypopigmented center and eccentric hyperpigmentation, and more presence of vessels. Also, it was very interesting to revalidate that melanomas in patients with two red hair polymorphisms have less dermoscopic criteria, less dermoscopic colors, and total dermoscopy score in the range of benignity. It means that they are more difficult to be diagnosed. Also, we analyze the comparative approach in patients with many nevi and melanoma. And in this context, in patients with two red hair polymorphisms, comparative approach is more difficult to be applied, and we can have some false negatives. It means that some melanomas in red hair individuals can be very similar to benign nevi. Other genes that can be important in the morphology of the tumors are MITF, that is associated to a high number of nevi and also associated to fast-growing melanomas. BAP1, that is a gene that is associated not only to cutaneous melanoma, but also uveal melanoma, and specific tumors in the skin that we call them BAP1-associated tumors that have specific dermoscopic characteristics with an hypopigmented areas inside the nevus. And sometimes these hypopigmented areas are surrounded by globules or pigment network. And finally, in the families with mutations in POT1 and telomere genes, we also can identify that the prevalence of schizoid melanomas are much more frequent than in normal population. As a conclusion, I can say that genetic background can influence clinical characteristics and also dermoscopy of melanocytic tumors.